Hi, I'm Dr. Nixon with Healing Peak Regenerative Medicine's Longevity Channel, and today I want to talk to you about something I haven't talked about yet on this channel, which is postpartum pain. And this is a really big area of pain, and a lot of women experience it, and there's not a lot of resources out there. And there's, once you have, finished with your labor and then birth, then they kind of discharge you, like your OB/GYN's like, yeah, okay, we're done, see you later. But a lot of times women experience a lot of postpartum issues and don't really have a place where they can go or a resource. There's this kind of interim time after like the postpartum period in which you have your last checkup, and then, or after, labor, you have your last checkup after labor, and then you kind of like, okay, go see your primary care doctor. But primary care doctors are not really experts in postpartum care or pain, and so they typically leave something to be desired, or the patient or new mother doesn't really get the answers or that they need or the direction that they need. And so something that happens a lot is low back pain. So a lot of postpartum issues can be labral tears in the hips. Labral tears can happen very easily during pregnancy and labor in either hip, and I'll explain that in just a second. And then low back pain can be very excruciating in new moms. One of the main reasons for that is a separation in the abdominal muscles. So you have your ab muscles, and there's a very thick ligament in between your abs. And sometimes during pregnancy that gets stretched out, and then it doesn't go back together well, or it can take a lot of time to get all the way back together. And when that's stretched out like that, then your abs don't activate the way they're supposed to, and that's what's stabilizing your lumbar spine. And so your core is kind of wibbly wobbly still, and you are breastfeeding potentially, or picking up a new baby and carrying it around. And while that might seem, maybe while that baby may seem light or young or tiny, it's still putting some pressure on your low back, and the way that your ergonomics are in carrying that new child around can really affect how your body feels. And so it's really important to see a specialist that understands postpartum pain, and then also what to do about that to make sure that you heal correctly. So what happens during pregnancy is your progesterone levels are very high, and then there's another hormone called relaxin, and relaxin and progesterone together allow for your body to expand to carry a baby, which means all the ligaments are very loose and very unstable, but in a way that we need that to happen so that you can actually have a baby, right? Which is an incredible thing. But those hormones that are in your body during pregnancy don't just go away as soon as you have the baby. It takes time to get back to what your normal or your new normal will be after you have a baby. And so there is, especially if you're breastfeeding, relaxin stays elevated in the bloodstream. And so that means even after you've had your baby, your ligaments are still loosey-goosey, and that can also make it more difficult to tighten up the places that need to be tightened up. Or if you have injured something during labor, or you had a very large pregnancy, as in like the baby was 10 pounds, or you had twins or something like that, which created a DR, which is that separation in the abs, then it could take a while longer for your body to recover from that if you're not sleeping through the night, and if you're breastfeeding, your relaxin levels are not coming down. So what can you do about it? There are lots of things to do about this. So please don't sit at home and suffer and be discouraged. I talked to so many new moms that are so discouraged because they didn't know where to go, and they don't know what to do about this pain, and they don't understand why it's happening, and you get overwhelmed in tunnel vision with your new baby, and you kind of just suffer with it because you don't know where to go or where to look. And so I wanted to make this video to reach out to any, new moms out there, or anyone who has a toddler that is still suffering from these painful things, that is like, I never healed, or something's still wrong and I don't know what it is, but I don't know who to ask. So Basically, what you can do is there are physical therapists out there that specialize in pelvic PT, and that is a type of physical therapy that strengthens the pelvic floor, which can get very injured during labor and or childbirth, and for actually many other reasons. And the diaphragm and the pelvic floor, so it's the diaphragm and the pelvic floor, are part of the scaffolding in your core. And if they are weak or not functioning correctly, then the low back can become unstable as well. And so you really want to strengthen those areas when they're weak. And so a pelvic floor physical therapy specialist is really, really great. And I have one that I refer to in particular. So if you're in the area and you want that information, South Seattle area, I'm happy to provide it for you. And then the other thing you can do is if you have a labral tear or you have hip pain, because you won't know if you have a labral tear or not, one of the key findings is a popping or clicking in the hip that's painful. And if your hips are not working the way that they should, or they're still painful after labor or delivery or after pregnancy, there's a very good likelihood that you have some type of tendonitis or issue in the hip, and prolotherapy and PRP can fix those problems so that your body moves the way that it's supposed to, and you can continue, being active and being present for your new family member. And then lastly is that low back pain. So first thing that needs to be ruled out is whether or not you have a DR, the separation in the abs. If you do have one, then it's important to focus on strengthening that region. And again, a physical therapist who specializes in pelvic floor is going to know how to do this as well. And so they can be such an important member of your team. And then acupuncture can really help to loosen up the muscles while you strengthen them. So the loosening of those muscles will decrease the pain while you're strengthening the thing that needs strengthening so that pain doesn't come back. And lastly, there can be some instability in the lumbar spine or in the sacroiliac joint. So your sacrum is a little triangle muscle, and it's attached to your iliums. And so, iliums, we'll just, for simplicity's sake, so you have your hip muscles, kind of where the pants sit on your hips is that iliac crest, and then you have your little sacrum in the back, and then right above that is your lumbar spine. And what can happen when you're pregnant is, the lumbar spine gets a greater curvature, and also the pelvis, the sacroiliac ligaments that attach that sacrum to the ilium, that should be kind of an immobile structure. It's not a movable joint. It's a very fibrous, it should be pretty immobile joint, becomes more mobile to make room for the baby. And if those don't tighten up the way that they're supposed to after you have the baby, then that can create a lot of low back tension and a lot of pain because your muscles are tightening up around that area. Especially sciatica in new moms can all be a component of instability in the low back and instability in that sacroiliac joint. And the great news is that prolotherapy, regenerative injection therapy, and platelet-rich plasma therapy can fix that, along with making sure that you don't have pelvic floor weakness or weakness in the abdominal wall in the front. And I just wanted to talk about this, like I said, because it's such a massive issue. So many mamas, right after having babies, just deal with a lot of pain, and they're focused on the new job that they have and just kind of suffer through it because they may go to their primary care doctor and they're like, oh, here's some muscle relaxers, or oh, go get some massage or whatever, and it kind of helps, but it doesn't fix the problem. So there are things that fix these issues, and they are safe during breastfeeding if you are breastfeeding, and they really have no downsides other than you just got to show up. So thanks so much for listening today, and that is it. Thanks so much. Please share my video if you know any new mamas who need to hear this.